Hi, I'm Doug Ichikawa, a podiatrist at the University of Washington and in Bellevue. I'd like to talk to you briefly today about the pros and cons of bilateral bunion surgery, which means having bunion surgery on both feet at the same time. As you can imagine, it's a bit more difficult with recovery, especially in the first couple of weeks, but in some cases it is advised as there are considerable savings of recovery time and money by doing it this way. So here goes. The decision on whether or not to do one or both feet for bunion surgery at the same time is a big one. And today in this video, we'll bring up some of the factors to consider before committing. The recovery from a bilateral bunionectomy will most definitely be more difficult, especially for the first couple of weeks. The big deal about bunionectomy surgery being done bilaterally or with both feet at the same time is that after surgery there is a variable amount of weight, sometimes none, that can be put on the foot that had surgery. Even though the bilateral bunionectomy surgery is more difficult to recover from, there are some advantages. And these include simultaneous healing. In other words, both feet are healing at the same time, and only one anesthesia is needed instead of going back for another surgery. And there is only one recovery period, which might be advantageous for work, trips, or school. And there is oftentimes less out-of-pocket expenses depending on your insurance plan. There are several reasons why one shouldn't put weight on their foot after surgery, and it all depends on the type of surgery being performed. One is soft tissue swelling, and this really is important for the first 1 or 2 weeks. And the second is if you had an osteotomy or bone cut and realignment, or arthrodesis where the joint is fused with plates and screws. If weight is put on the foot that had a osteotomy or arthrodesis too soon or too much, the outcome of these surgeries could be severely negatively impacted. With pretty much all surgery, there is a gradual progression to weight bearing. And it starts with strict foot elevation and strict non-weight bearing, progressing to toe touch weight bearing, where only ounces of weight are put on the foot. And then it gradually progresses step by step until full weight is put on the foot and the patient is finally allowed to progress to athletic and high impact activities. This will greatly depend on the type of procedure being performed. With the osteotomy or bone cut or arthrodesis or joint fusion, the two bony surfaces are realigned with hardware such as a plate or screw, and any motion between these two bone surfaces could result in delayed or non-healing of the arthrodesis or osteotomy. That's one of the main reasons that non-weight bearing is required after one of these surgeries for a matter of weeks. After surgery, if only one foot was done, then crutches, a knee scooter, or an iWalk can be used. If both feet were done, then you're really down to a wheelchair or crawling on your hands and knees to keep weight off of both feet. Here's a picture of a knee scooter and an iWalk device, and both are great appliances to help you get back to activities of daily living after a surgery. These are only really valuable if you've only had surgery done on one foot. Crutches are always recommended after surgery, and these will help especially around tight areas like the bathroom, and are valuable if one foot or both feet were done at the same time. If both feet were done at the same time and you are not allowed to bear any weight on your foot, then you will need a wheelchair. Certain procedures like the syndesmosis bunionectomy will allow you to put weight on your foot, but only a certain amount of steps per day. And after you're done with those steps, it's back into the wheelchair. Driving is complicated after foot surgery, and it depends on if you have a clutch and if you can drive with your left foot or with 2 feet, and sometimes this is recommended and sometimes it could get you into trouble. When in doubt, it's always best to wait until you're fully healed to get back to driving. Here's what can happen if you try to push through it and walk more than is recommended by your doctor. These include things like non-union or displacement of the bone cut or a recurrence of the bunion, and these are complications that can have severe consequences. How much harder is it to do both feet at the same time than to do one foot? The answer, 60%. Now that's simply a guess and an estimation from patients that we have had in the past, but it should be known that it is definitely much harder than having one foot done at a time. There are certain wild cards to help you determine whether or not you should have both feet done at the same time. And the number one is who can help take care of you, especially for the first couple of weeks. The second is what are your work requirements. And the third, that's as important as these first two, is what do you need to do for exercise. And if you only have one foot at a time, it's much easier to get in some good exercise. If you have both feet done at the same time, you're really down to cycling with your heel on the pedal or swimming or sitting aerobics for exercise. The procedure that I'm currently using for bunionectomies is the syndesmosis bunionectomy, and this allows for limited immediate weight bearing. This makes it amenable to bilateral bunionectomy surgeries in selected patients. Having bunion surgery on both feet at the same time is a major commitment, and I hope you'll consider some of the factors that we brought up in this video before making your decision. I hope you've learned a bit about the bilateral bunion surgery and feel educated about the pros and cons of doing so. There is a right answer for you on doing one foot or both feet at once, and it really depends on your specific factors. If you'd like more information about this or the syndesmosis bunionectomy, please take a look at my website, bellevuefoot.com. Thank you.